Can you give us an overview of what's happening with regard to rates? And also, I'd like for you to address why the rest of the country could care. I mean, it would be very easy for people to go, well, you know, it's not my problem. Why should we care what's going on down there?
Well, the reason that we should care, and thank you for the question, the reason that we should care is that HIV is an infectious disease. And people are not just located in one part of the country and have absolutely no contact with other people in other parts of the country. And what's taking place in the South is something that is very different than what we see in other parts of the United States. So the South comprises about a third of the US population. About 45% of HIV diagnoses take place in the South. The 38,000 new infections that take place each year, half of those infections, new infections, take place in the South. When you take a look at AIDS deaths each year, you find that people in some southern states are 3 times more likely to die from HIV as compared to other states in the United States. So in particular, Alabama, Louisiana, as well as Mississippi have rates of HIV death that are 3 times higher than, say, Maine or Vermont. And then when we take a look at other metrics, such as awareness of HIV status, about 87% of Americans who are diagnosed with HIV or already know that they're HIV positive. In the South, you don't necessarily see that. About 70% of the worst performing states for HIV diagnoses are in the South. And then you have other issues. I mean, it's not just about the HIV epidemic. You did talk about poverty. You did talk about race and ethnicity, and we find that 53% of African Americans living with HIV are in the South. That's where most of the concentration of African Americans are living with HIV. But then we have other issues as well. We have hepatitis C. CDC reported that there's been a 3-fold increase in hepatitis C between 2010 and 2015. Most of that is taking place in the South. Hepatitis C and HIV are diseases that are transmitted through injection drug use. And what we have in the South as well, primarily in the South, is a huge opioid epidemic that's concentrated there. So it really is the perfect storm where we have this syndemic. It's HIV, it's hepatitis C, as well as opioids that is producing conditions that are worse in the South than in other places of the United States.